That's great. Well, thanks very much, Liz, and thank you to Liz and Georgie and colleagues for the chance to participate in this event today. I'm going to talk about the chain network, where it came from, what it attempts to do. I'm going to run through a couple of slides from the chain website. Then I'm going to do a couple of live demos of using chain. I've already said, I think, in the intro to the session, that we'll take some questions from people participating, and we'll turn those into questions for members of the chain network. And Liz mentioned there's a lot of people already part of that network. There's nearly 15,000 now. So if people have questions and they want to test this out for real, we won't try and do it in real time because we've only got half an hour for this session. What we'll do is we'll collate the questions that are submitted, either typed into this webinar, or if you submit them by Twitter. And we'll collate those and we'll turn them into questions, which we'll send out either later today or tomorrow. And hopefully chain members will respond, and that will give you, if you really want to test it, it'll give you a chance to see how the network functions. Okay, a little bit about how chain originated. It started life when I was working in the NHS National Health Service Research and Development Program almost 20 years ago, working with a particular emphasis on the implementation of evidence-based changes from research evidence that had emerged in the NHS Research and Development Program, and which we wanted to see incorporated into practice, either in clinical practice or in terms of the organisation of health services, to improve what we do as clinicians and managers of services and trainers of healthcare professionals based on emerging research evidence. And as has been well documented, there is a significant gap between the emergence of research evidence and its uptake. And to cut a long story short, the chain thing came about because it seemed like a good idea to create a map of people who were interested in taking emerging research evidence, turning that into change in what they did as healthcare professionals and as managers of healthcare services. And the original concept for chain was very much a simple one. It was one of a map of people who were interested in getting connected and getting awareness of who else was out there, what they knew about, what they were interested in, and creating linkage. And the timing of the emergence of that map, which was 19 years ago, was quite fortuitous because it coincided with the opening up of the internet to NHS employees and a growing ability with my colleagues in IT to manage online networks. So within a space of weeks, there was a realization that what we were starting to create, which started life as a fairly modest idea of a map of people who were interested, had morphed into the origins of a network, the early stages of a network. And the way that sort of gained traction was quite surprising to me, but you know, it hit the spot clearly with a lot of people in a very simple way, in that they were able to see who else was out there and to make contact with one another. And you know, for the last 18 years or so, chain has grown with that process, and it's remained a very loose network, which has the people who joined it have in common the fact that they work somewhere in the health and social care system, and they share an interest in incorporating research evidence into what they do to improve what they do, and fundamentally they must be willing and able to share their knowledge and experience with one another. So that reciprocity that we heard about earlier in several of the sessions has been fundamental to the way that chain works. If I put a couple of slides on, I'll show you this one, George.
I think it is the PowerPoint.
Oh, yeah, probably. Yeah. Okay.
Go up and press these.
Right.
There.
Go on.
There we go.
Brilliant. Okay, so there's a few slides. Just have a quick look at. First one is the chain membership, which has grown more or less along a straight line. The network's grown by word of mouth. It it's a very light touch network. There's only 3 of us who run the thing. It's now, as I say, nearly 15,000 members, and it's grown because people have said, hey, this is worth joining, and told their colleagues about it. It's never had a big push, and it's sort of grown by sliding itself into the water and through recommendation from other people. As you can see, that's more or less a straight line, so it certainly hasn't done a Twitter or a Facebook, but it is obviously a lot more niche and limited in its aspirations. This is a look at the chain membership in the UK, across the UK. So this is a couple of months old now, but it's over 9,500 in England, over 1,500 in Scotland, and smaller numbers in other parts of the UK. And we've also got membership outside of the UK. Biggest contingents coming from Australia and New Zealand. That's the red section. The Irish Republic has a big contingent, and we have other components in Scandinavia and in Canada and other places. And this is probably the most important slide I'm going to flick through. It shows the main split of members in chain. This is what makes it particularly powerful, I think. The fact that we've got these 4 key groups of people talking to one another and able to identify one another and coalesce on different topic areas. Without one another, without communication between these groups, it's very little for anything to change, actually. So, we've got researchers and managers, health and social care frontline professionals, and the educators of the next generation of healthcare professionals, all in the chain space. And it's a very loose space. It's a very loose ties network, as Paul Granavetter would describe it, where the sole area of overlap is people's willingness to share their knowledge and experience, and the fact that they some way, shape or form fit into the health and social care economy, and they are interested in changing for the better based on research evidence as opposed to someone's idea of a good idea. Okay, the other thing I just quickly wanted to show you was the split between different areas of main interest. In the case of the frontline professionals, this would be their specialisms. And as you can see, we've got pretty well all the bases covered there. We'll probably need a larger component in social care if we're going to get truly integrated. But the purpose of the slide is to show that there's people from all specialisms represented in chain. This is quite important, I think, because it enables the potential for cross-fertilization of ideas and experience from one sphere to another in a way that it rarely happens other than through water cooler experiences, and in some cases that doesn't happen when people are in very different types of organization. So the potential here for learning from very different groups, people with very different interests, and of course chain's fundamentally from day one being multi-professional. So it's cross-organizational and multi-professional. The other thing that we have within chain is subgroups which will cross-cut all of those specialisms in many cases and involve people from different professions and different walks of life, but who have common areas of interest, be that quality improvement, improving patient experience, they've published research perhaps, or they're interested in patient and public involvement, or they're interested in self-management of long-term conditions. And these subgroups are very much the engine that drives along the network these days, because a lot of learning and cross-fertilization occurs within the virtual space of the subgroups. Right, I've got a question coming in. I'm going to sort of deviate a bit and start answering individual questions now, but they'll all be answered in due course, as the civil service would say. This is how chain is resourced. It's a consortium of stakeholders led by the National Institute for Health Research, which is where this network emerged from, really. But as you can see, there are other organizations which have different main spheres of interest that have come on board and who make use of chain and who support what it's trying to do in breaking down boundaries between different groups. And they include organizations like the Health Policy Improvement Partnership, the NHS Leadership Academy, National Institute for Health Research, etc. We've also got the Irish Health Service there represented.
Okay, what I was going to do now was go back to, Georgie, can you help me out to get back to the website? I was going to do a couple of demos. At the heart of Chain, what makes it function is an online directory of the members. So the deal with Chain membership is that anyone working in healthcare or related research and education can join on the basis that they join free of charge, but they're willing to share their knowledge and experience with other members if called upon, and they won't use this as a means of selling themselves or their own organisation. I mean, that's very simple criteria for joining, when people join, they receive a password and they're able to access this password-protected website. It's probably better if I shut up and show you how this is used, because that kind of conveys the potential of this network far better than me rabbiting on about it. But supposing we wanted to find, for whatever reason, we wanted to find some healthcare professionals, so we'll go to professional roles field, who are practitioners, who let's say are interested in child health. So if we go to main area of interest, we'll go to child health, and let's put in another criterion. Let's say we wanted to focus on those who work in primary care, primary health care. So if we check those criteria, we could check as many as we wanted. But if I search that, we should find, hopefully, be able to see what I'm doing on the screen. Is that right?
Yeah.
Yeah, good. Okay, you can see that we found 233 people who meet those criteria, and they're just listed here alphabetically. Now, they should be a pretty good cross-section. I'll just have a quick peek at some of these A's. So the first one's a PhD student at Sheffield University. Second one is a clinical specialist practitioner in Wirral. Next one's an interim medical director in Northumbria. You can click on any one of those and get more information about them. Right, so this information is there for any one of those. And what's captured here is what we get in their initial joining form, and also what we get updated every 6 months. We chase people to update their records. And critically, it contains their email address. So identifying people with specific interests is very quick and very easy with Chain. Now, that's a pretty big number. So I'm going to, before I do anything else, I'm going to narrow that down a bit. Okay, so we're going to refine that search because 233 is too big, I think. If we said, oh, okay, let's have a look if any of those people are also interested in obesity, because I know we've got a subgroup for obesity that we set up a couple of years ago, which is obviously such a hot topic at the moment. And that comes under health and well-being. We've got a special interest group for obesity. So it's now looking within those 233 healthcare professionals in England who said they were interested in child health, who are practitioners and working in primary care, and it's having a look to see if any of those are also interested in obesity. And hopefully we found some. Yeah, okay, so here's the ones. And it's found 31 of those folk are also interested in obesity, and there's one of the ones we found before, so there's Lorraine Adams in the Wirral. We could also say, well, actually, this is right across England. I wonder if there's any more locally, so we could refine it again, and we could say, well, let's look in the patch that we're in at the moment, and I'm sitting in Yorkshire and Humber at the moment, so let's narrow that 31 across England down to just those who are local. And again, we should be able to, yeah, we found 3 people. Okay, so there's consultant in public health in Bradford, capacity development manager in public health in Wakefield, and an assistant director of public health in Doncaster. So those, if I wanted to, for example, to identify those people for the purpose of some kind of local event, or to talk about a local guideline for childhood obesity in primary care, then maybe they'd be the people to turn to. But, you know, it's as simple as that to identify folk. And we can do it in all sorts of different ways. We can do it, I did that within England, but we could do it globally. We can search with lots of different purposes in mind. And one of the kind of aspects of Chain which maybe makes it a little bit different, a bit looser than other networks, is the fact that it's got a sort of deliberately pluralist agenda. I think one of the other presenters earlier, the American woman, mentioned, that if the network meets the expectations of the participants, the member of the network, then you're on the right track. What we recognised with Chain was that there were many horses for courses, and it would be a shame to lose the network because we weren't doing exactly the same thing for everybody. So what we try and do with Chain is make it add value to people who want to use it as a source of intelligence, or in some circumstances, a comfort blanket and the possibility to identify people whose brains you can pick or with whom you can collaborate, as well as people who want to use it much more proactively as a network. We can use it to enable members to ask questions of one another, and I hope you'll take up that offer and give me some real questions that relate to your areas of interest or particular challenges at the moment, and just give me a little indication about who you think would be likely to answer that, who you might want to direct it to, and we'll turn that into what we call a targeted message, which we'll hone and we'll send out to people who we think could possibly answer that, and we'll ask those people to respond directly to you. So if you send that in either on this webinar facility or do it through Twitter, we'll do just the same. It'll probably be tomorrow before you get any responses, but fair enough. So yeah, different ways people use it: asking questions, using it to survey people to get a quick response on people's opinions or pressures or any number of reasons why you might want to survey people, and also to identify collaborators, and that might be in the context of coalescing with a view to putting together a research proposal, or alternatively maybe to turning some emerging research evidence into a change in local policy, or the creation of a guideline, or any number of different ways people can use Chain. And we regarded it as a strength that we can offer different things to different people, because not surprisingly, different groups have very different expectations, and it's good that we've found that people who use Chain passively, who wait for messages to come to them rather than going and using this online directory themselves, those folk who use it passively, wait for questions to come to them or wait for intelligence suggested by other members to come to them. They value their membership of the network just as much as those people who use it far more proactively, who are probably more typically networky, switched on, social network type people. And I think it's a strength that we can appeal and add value to people at different ends of that spectrum. So one of the questions that's been raised, I will try and address now. Someone said, what are the measures of success, and how do you know that a network is effective? Well, there's a few answers to that. The first one is, we did in the fairly early days, we did the usual stuff. We got proper evaluation done. And if you're interested, if you go to the Chain website, under the resources section, there's actually reports on 3 evaluations that have been done on Chain. But the most sort of academic and scholarly one of those was actually undertaken by some folk at the UCL in London, and they had it published as a BMJ paper. So that's the kind of academic take on certainly the early days of Chain, and an evaluation by external researchers that was published in BMJ. But we know from other mechanisms as well. We know from the feedback that we get, and there's another report on there of a fairly quick survey we did the year before last using SurveyMonkey in Scotland. We asked the members in Scotland whether they valued Chain, how they valued it, how they used it, etc. And that's been turned into some slides that you can download and take a look at, as well as the slides that summarise the responses. There's some very good sort of in vivo quotes from people that say how they've used it. We also get a lot of sort of unsolicited feedback that tells us it's good. But probably the most telling way that we know it's doing something useful is the fact that people rejoin it. We do pest them every 6 months, and if they didn't rejoin, then if they don't sort of confirm their details or update their details, then they drop off Chain. Now, lifespan, certainly over the last 10 years, Chain's membership has grown from just over 2,000 to its present level of around about 15,000. If it wasn't working, I don't think we'd continue to grow like that. We might get that effect for a short while, but it's gone on for a good length of time. It's not one of these things that you can say, oh, we count the number of hits and that tells us how good we are. It isn't. That's totally spurious, and you've got to be more sophisticated in your measurements. But I think that's one of the conundrums of working in the field of networking. Is it's not something that you can measure particularly simply. 5 more minutes. Yeah, that's fine. Okay, another question. Right. Yeah. Thanks for that prompt. Yeah, we've got 5 minutes left. One thing I wanted to mention was we established a subgroup. I'll show you those subgroups because there's lots of topics there that probably of interest. So if I go to a new search here, I can take a look at the subgroups. Okay, let's do this across the full membership. Our subgroup list, you may look at it and think, well, these are a pretty random set of topics. Why have you chosen these? Well, it's basically because people have emerged and said, please, can we have a subgroup on this topic area? So, for example, we've got one on bereavement and loss. It's a relatively small one. One, better care without delay, so the whole reducing delays agenda. We've got a lot of, a big subgroup and a lot of special interest groups that the Macmillan Cancer Charity asked us to set up some time ago. Other ones on dementia, clinical, all sorts of topics. Many of these topics, not cancer perhaps, but certainly many of the topics will draw people from all different specialisms and from those 4 main groups of clinicians, managers, educators and researchers, which I think is really healthy and allows that cross-fertilization to occur. But the most recent addition to our subgroups is this one, Networks and Networking, which we have yet to officially launch, really. We've just, it's off in the way. We've slipped it into the water, and we've just populated this at the moment with people who've already expressed their interest in networks and networking. We're going to be launching this in the next 2 months or so. We've got 500 odd people across the Chain network who are in this network already, and that's before it's officially launched, so it's going to hit the road running, definitely. So these are the enthusiasts for networks and networking who are already Chain members, and say we've got 500 of those. They'd be a useful set of contacts for anyone who's still tuned into this webinar, I think, because they'll come from all walks of life. They'll actually come from those different countries, and I know that the awareness and potential of networking is particularly strong in places like Australia and Canada and some degree Scandinavia, where the distances, physical distances between people, has made networking more of a necessity than a luxury. So it would be a good cross-section of folk involved in that, and I'd very much like to invite anyone still tuned in to not only join Chain and make full use of it, but also to indicate your interest in networking and join our soon-to-be officially launched subgroup for networks and networking. Any other questions that I could address in this? Right, yeah, we did that one. Yep, I think we've got all the kind of questions that I could answer here and now. As I say, the offer is there for anyone still tuned in or your colleagues of work. If you've got a particular question that you'd like to address to Chain members, bang that in either through the webinar or through the Twitter feed. We'll get that question turned into a targeted message, and you will get responses back from individual Chain members, and hopefully that will illustrate how the network functions. But you're almost welcome to join and use it. And if you're looking for the Chain email address, I think it's on it's on the resources page. There's also some examples there, I think, aren't there, Georgie? Yeah, how people have used Chain. Right. Yeah. You can Google it, and if you just Google Chain, you'll find a few spurious hits there. But we're usually within the top 10, and it's the one that's hosted by the ULCC, the University of London Computer Centre. So it's Chain at ULCC, and you'll see the rest. Okay, thank you very much.
Yeah, great. Okay. Well, thank you very much, David.